upon you wherever you are, a brand new episode of Black and White. Today we are talking about something that we are all concerned about. Our hair is considered to be the crown of us as females and as males as well. Men do take care of their hair as much as females do. But there's a problem that these days we're seeing and we're observing that this problem is a little bit compared to previous years. It's more. Baldness. Baldness is the loss of hair partially or completely of your skull or of your hair. And this problem, of course, occurs in men more than women. But lately, we've seen that some females, they don't, of course, lose their hair, all of their hair, but sometimes we see that there's a part of the hair that is empty, or partially you see that the line of the hair upon your face, it's now backward a little bit or something. This problem, of course, occurs at the mid-age, and there are a lot of reasons behind that. Today we are going to shed some light upon that, upon the reasons behind baldness. Is it genetic, or because of what we eat, or because of the exposure to the sun, or because we cover our hair? Because we've heard lots of things that may cause baldness, both for males and females as well. It takes me a great pleasure to be welcoming Dr. Samir Ibrahim, the plastic surgeon and hair transplantation consultant and the spokesperson for the International Society for Hair Restoration Surgery in the Middle East. Dr. Samir, welcome to Black and White.
Thank you.
Dr. Samir, what causes baldness?
Actually, as you said, hair loss causes baldness.
Yeah.
Permanent hair loss causes baldness. Mm-hmm. We have different types of hair loss.
Yeah.
Actually, each one of us is losing hair every day. This is natural to lose hair every day. Mm-hmm. We have three phases of hair cycle. The first one, the growing phase, we call it anagen. The second phase is called catagen, and between them, the resting phase, we call it telogen. And yeah, it's normal to lose up to 100 hairs a day. Every day. 100
hairs is like, because we cannot count the hair actually after combing our hair, but as amount of what? Very little amount you mentioned, or after combing our hair, I do look and see how much hair is on the floor. Yes. What could be a red flag, Dr. Samir?
This is natural to lose hair because the hair is going through this cycle.
Yeah.
And natural to lose 100 even to 200 hairs every day. But if the hair regrows back again, that means everything is okay. But when we lose hair and the hair is not growing back again, so we have permanent hair loss. And this permanent hair loss provides to baldness. And we have problem. So if one of the diagnostic issues is to count the hair. We ask,
count.
yes, if especially females, because we have problems with females more than males in diagnosis. So we ask to collect every day the hair and to make hair count.
Yeah.
This is one of the diagnostic methods to see if we have permanent hair loss or temporary hair loss.
Permanent in terms of what, Dr. Samir? Couple of days or couple of weeks, or?
No, couple of days and weeks and months. It starts usually.
If for 4 or 5 days I see that my hair is being lost in a rate that is more than what I'm used to, completely to go to
Yes, so we have to be aware, not to surgeon, actually. We have to go to a doctor, dermatologist first, and the dermatologist, he will put the diagnosis, or to go to a hair transplant specialist, doctor, who knows also about the issues of the hair.
What might be the reasons behind the hair loss, Dr. Samir? A lot of times we hear that it's food, or for females, especially in the Middle East, and it was one of the, I don't know, this fact, we've heard a lot of physicians, they denied, or they proved that it's wrong, that the veiled females or females who wear scarf, that they have more hair loss than the others, or it's the exposure for the sun. What could be the reason?
Okay, it depends about whom you are talking about, male male or female?
Females first, and then we'll talk about
females.
males.
Okay, females is a little bit complicated problem than males. In females, we have different types of hair loss.
Yeah.
Actually, we have different diseases which cause hair loss. Thyroid gland problems, either hypo or hyperthyroidism, hypo or hyperfunctioning of the thyroid gland causes hair loss. If we have hormone problems causing ovarian cyst, then we have problems with menstruation.
I guess the ovarian cysts, they affect the hair in an opposite way. They make it more, I guess,
no.
Sometimes hair loss.
Ovarian cysts, yes, causes hair loss. If we have malnutrition when we are doing diet without control of dietitian, so we lose many vitamins and proteins and minerals, so we cause hair loss.
And sun exposure to the sun?
Sun exposure and the veil and gotra and other things, I don't believe that, and water also. They are not one of the main reasons for hair loss. They might affect the hair shape, but not the hair loss. As we said, these diseases, they cause something like 50% to 60% from hair loss in females. And we have the rest, what we call female pattern hair loss related to hormones. Actually, until now, we don't know what is the trigger. It's genetic, it's inherited cause. We don't know what is the trigger. While in males, we know what is the trigger. The trigger in males, hair loss, is the testosterone or the final breakdown product of the testosterone, which is dihydrotestosterone. It triggers the hair loss in males. It causes thinning and miniaturizing of the hair follicles. But in women, we have this type of miniaturizing and thinning of the hair, but we don't know what is the trigger until now. That's why
thanks God it's for males only and not for women as well.
No, but we suffer androgenic, yes, female androgenic alopecia.
You mean female without any hair on their skull?
No, there are different times. Why we see in males that the hair loss starts from the temples and started to recede, and later on we start to lose hair in the crown area, and it opens in the upper and the top of the head. And as we see here, maybe in this picture, this is in males. We see it starts in the temples and proceeds, and it starts also in the crowns, and they meet in the middle of the scalp. So we see male pattern looks like this. But in females, actually, we don't lose the hairline. Yeah. In female androgenic alopecia,
we're seeing what?
Yes, in females, it looks like that. We keep the hairline. The hairline is intact, but we start to lose the females. We start women. We start to lose
the middle area.
Actually, behind the hairline, we start to lose the hair. We call it shedding of the hair, thinning of the hair. And we have different three grades according to Ludwig. Three stages of hair loss.
I heard a lot, Dr. Samir, that you have to cut your hair so that air comes in, and it's important to cut your hair every now and then.
No, this is only a myth. Actually,
this is another myth.
Yes,
right.
Cutting hair, that means that makes the hair more strength. Yes, strengthen the hair. This is another myth.
Really?
Yes.
So if you have hair split, how can you get rid of that? Cutting it is not going to affect you in a positive way?
No, it will. That actually you get rid from the split.
That's it?
Yeah, that's it. Yes.
Not more than that?
Not more than that.
Yeah. Dr. Samir, now I want to go and start talking about the baldness problem. If I do have this problem and I've been eating healthy and now the reasons are stronger than me, so I'm going to go for a dermatologist and ask for a solution for that. We hear about lots of things: keratin therapy and laser and hair transplantation. Tell us more about each.
Okay, we'll start about hair transplantation maybe, yes.
Okay.
If we have permanent baldness, permanent hair loss, I think the only solution is hair restoration surgery. That means hair transplantation. As I said before, it's good to understand. If we want to understand how hair transplantation works, we have to go back to etiology, and we see that we lose hair in the top of the head, and side and back of the head we have what we call the permanent. We call it permanent hair. So usually we take hair from the back side, from this permanent hair. We call it donor area. We take, whether we take strips or we take follicular by follicular, and we transplant it in the bald area.
And you transplant only a small part? How it spreads?
We take a strip, actually I have here on the PowerPoint, we take a strip and we cut it in small pieces. Each piece contains 1 or 2 hairs, sometimes 3 to 4 hairs. We call them follicular units. We're supposed to think that hair grows hair by hair, single hairs. But lately we see that the hair grows in groups. We call them follicular units. Each follicular unit might contain 1 single hair or 2 hairs, sometimes 3 or 4 hairs. So we take them as they are, and we retransplant them in the bald areas. Laser is something that is becoming a trend, and it's in everything when it comes to the health and the medical field. For hair as well, we've been reading a lot in magazines, and we've been watching some aids about transplanting hair using laser. Okay, I thought that you are talking about treatment of hair loss by laser.
And treatment as well.
Okay.
Yeah.
Because these are different, totally two different issues.
Just give us an idea about the
laser in hair transplantation abandoned long time ago. It's useless actually, and actually we have avert effects by using the laser, because when we are making the holes, we need blood. Blood is essential for the healing of the grafts or the hair. While by laser we burn the skin, and we don't have blood in the field where we transplant the hair. So the regrowth rate in using lasers was very low, and it was abundant, I think, something like 15 years ago. It's been tried and abundant. I remember we removed the laser from our clinic, I think, 13 years ago.
You don't recommend it?
We don't recommend. Nobody is using laser now for hair transplantation, But some people